Welcome to your Aged Care Compass podcast. We help you make sense of the Australian aged care system by having conversations about topics you've asked us about. We're joined by thought leaders, professional experts, and people just like you and I who talk about their experience in the aged care sector. Hello everyone, and welcome to today's episode of the podcast. This month, our theme is technology, and I'm joined by the CEO and co-founder of Conpago today. Conpago is a digital communication platform that supports the care sector. Ali Galadari is my guest. Ali, thank you very much for joining me on the show today.
Thank you for having me.
So you joined tech startup Conpago during your master's studies at QUT in Brisbane. What attracted you to technology and aged care, or the care sector?
I think what fascinated me with the sector was very much the disconnect between all key stakeholders, but most importantly, the care recipients and family members not having complete visibility of their care that's being delivered to them on a day-to-day basis. But more importantly, how fragmented the sector was and still is to this day, predominantly because it's been built on a lot of legacy software components or software systems, and the interoperability between systems communicating with one another that doesn't exist. And I think that's been a real key component why it really fascinated me to join the journey at Conpago. And with my background studying my master's in project management, I think that was one of my key components, was managing projects for larger healthcare organizations and seeing how departments were running in silos completely. And they weren't very clear on what's going on a day-to-day basis. So I think that's why it fascinated me to join the journey.
Excellent. And we're going to talk about that, the difference that Conpago is making in the sector throughout the conversation today. But tell us about the early days of Conpago. Who was using the technology and how?
Interesting enough, Conpago actually started from a key piece of research that was very much related to a connected kettle. So the whole premise behind it was to combat social isolation among older Australians. And what we noticed is allowing the care recipient or the family member to being able to connect with their loved one in their own home. And during around tea time, the connected kettle would alert them to let them know that their family members was ready to join for a chat and to be able to engage with them. So that's where we started from. And I think more and more that we started to dive into the offering and working with key pilots that we had in the beginning, we started to realize that there's a lot more impact that we can have. And that impact was very much supporting care providers and diving into learning a little bit more about care providers and how fragmented things were. That's where we started to zoom in on. So I guess they were the main users of our platform, helping care providers to run more efficiently, to be able to connect with their care recipients or their customers essentially, and their circle of care, people who are around that particular care recipient.
Excellent. Ali, since the company was founded in 2016, Conpago has grown significantly. Tell me about your Brisbane headquarters. Does the whole team, including your software developers, occupy this space?
Yeah, I guess it was a very important decision for us on a board level. We always wanted to give our customers, our care providers, the best level of service, and at the same time give them quality in our product. So having a Brisbane headquarters and having everyone, a full service team under one roof was very much the key focus for us. So it wasn't done, it was done very much on purpose to ensure that quality is always there. But very much on top of that is to support our customers. Customers in this space do always want to have a little bit more hands-on approach. And I think that's been one thing that we've been really focusing on, giving them the sense of clarity and sense of peace of mind, knowing that we're here. When they call, we're in the same time zone and we'll be able to respond to them almost immediately.
Yeah, and having visited your headquarters in Brisbane, I can actually attest to the advantage of having the whole team located in the one office. I think it's wonderful.
Absolutely.
So who is the product for, Ali?
The product is very much for multi-layered in terms of who are the beneficiaries of our system. So initially, it's very much for the care provider, the actual business, the person, the provider who's providing the care. But it does have additional components to it where allowing care recipients, family members, care staff to be able to capture information on the go and to be able to have full transparency on certain things that's related to them as an individual. So in hindsight, we're across 4 different tiers. Tier number 1 being the main care organization. Tier number 2 being the staff, on-ground staff. Tier number 3 being the actual customers who are receiving the care. And then tier number 4, people who are related to them, their circle of care. So they can essentially be across everything in real time. And I think that's the missing link.
Yes, I totally agree with you. Having been in that, that situation with my own parents, what I've seen, the capabilities of Conpago, I really loved it. And I wished that my parents' provider had used this kind of technology. It certainly would have made it easier for us as the family members of the older loved ones receiving care through their home care package.
Absolutely. Yeah.
So, Ali, how does Conpago's technology assist the retirement living sector?
We started to focus on retirement living because we started to realize one thing, that aging in place is a very important aspect. So retirees living in their beautiful communities, they also do need care at some stage of their life. And I think our focus has been that we want to be across the whole life cycle of every care recipient, being there from the get-go all the way till the end, because they will be transitioning from different tiers of care, but however, their data will remain with them because it's all within one system. We help operators, retirement operators specifically with an operational component, helping them to be a lot more operationally efficient and at the same time have a source of truth when it comes to managing residents' data and the residents' events and so on and so forth. But from there, we've started to realize that a lot of retirement operators, especially in the coming years, that they do want to have that level of offering where they can provide some sort of level of care as well in their communities. Now, either the retirement operator would be leveraging their own existing home care verticals or business units, or they would be partnering up with a home care provider that is externally providing those services. Conpago enables that, allows them to bridge that gap, allows them to directly communicate to the residents and their loved ones that this level of service is available at the tip of their fingers. And going back to being all in real time, everything is in one place. And I think that's been our core focus, giving the consumer experience to be almost flawless, everything being done within one platform rather than having 10 different platforms and getting overtly confused.
Yeah. If it's not too much of a technical question, I just wanted to ask you, I think this is fantastic and I just want to understand it a bit more. How does Conpago's software integrate with other programs or software?
That's a really good question. That's been one of our biggest challenges for a very long time. And I think over the years, the dependencies on legacy systems has been less and less. By legacy systems, I mean systems that haven't really developed or didn't have a pathway to allow other software companies or other software systems to be able to connect to them, predominantly because they want to control the complete environment due to data sovereignty, or that it's very much their tactic. However, that has been one of our biggest challenges, and we've been really clear with wanting to work with certain software operators only. They have to see that vision. They have to see that the fact that they want to work with other software providers. But then again, I always question the fact that care providers want a connected system. This has been a need for a very long time, because you can just imagine a care provider would have multiple different systems, from your finance to your rostering, scheduling, to your care management. And sometimes none of those systems communicate with one another. And it causes a lot of commotion internally for the organization. However, I think more and more providers are now realizing that having a connected system will really bring the efficiencies that they need. And in addition, it will reduce the frustrations internally for them. So for us, we only work with certain software vendors that do have open APIs, or they have some sort of connectivity through a middleware system. And I think it's quite limited in this space. Not a lot of software vendors have that as of yet.
Conpago helps care providers deliver home care that families can trust. By connecting existing systems into a single platform, Conpago unites communication, self-serve access, transparency, invoicing, and compliance, giving care recipients and their families greater choice and control. Providers benefit from a scalable, more connected way to operate that reduces friction and fosters trust.
We just chatted a moment ago before we started recording that you were recently down on the Gold Coast for the conference, and you are getting a lot of interest from providers now, particularly with the rollout, the commencement of supported home. What are you hearing from them? What are their challenges?
I think a couple of challenges for them has been very much around the co-contribution, understanding the co-contributions of each individual or each care recipient, and also how are they going to capture those particular co-contributions from their care recipients or family members? That's been one. The other one has been very much the grandfathering HCP and support at home. Where is the cutoff date and how does that look like? I think for them, it's very important to be able to continue to run their business, but also have the systems in place ready for when support at home kicks in.
Absolutely. Huge challenge to providers in the sector right now.
Massive.
Ali, privacy is a concern with consumers and providers. What reassurance can you provide to your clients that Conpago systems are secure?
Yeah, well, privacy and security has always been top of our priority, and that's another main reason we wanted to have everyone under one roof at Conpago HQ. But in addition to that, we have recently gone through significant security measures, and we align with Essential 8, which is the government's mandate. But in addition to that, we've also completed our ISO 27001, which is a security standard. It's a global standard recognized on a global level, and you have external auditors coming in to be able to verify that Conpago is meeting these security standards. In addition to that, we always have additional layers of security embedded into Conpago. We are actually thinking about bringing in AI into our offering as well. But I think the main question mark is security and privacy of that data and where is that going. So that's something that we're really factoring in and how we're going to be able to address that. But yeah, security is very much an important factor for us.
Absolutely. Dealing with such sensitive information, personal information. And I know, again, we had spoken previously about, correct me if I'm wrong here, but your servers being located in Australia. Does that enhance security? Like, what does that mean? Remember, I'm a nurse, I don't have a technology background. So if you could just explain, is that an advantage or does it not make much difference at all?
I think it is a must from the sector. It very much is a must. You have to have all your data stored within a database in Australia.
Yeah.
We store all our information on Google databases, but essentially it means that the data is not leaving Australia.
Right.
It's very much staying within onshore data houses or data warehouses where the information is still being held within the Australian territory. There are a lot of systems out there that are from external or from foreign companies coming into the Australian market. And I think that's one challenge that they're always going to have is where is that data being stored? And a lot of providers will be asking that question because it is a must.
Excellent. So talking a little bit about consumers and family members, this is me and my experience. What I love about this software is that families can use the program in real time and schedule their older loved ones' appointments and view when support workers are coming to the home so that there isn't any clash of appointments. It helps families know what is going on and when with their older loved ones, and the provider can see what the family is scheduling too. As I said earlier, I would have loved this feature for my mum's home care package. Talk us through what the benefits are for the families of the older loved one.
I think the main benefit for family members is that they have some sort of sense of control of their loved one, especially the family members who are very much involved on a day-to-day basis with their loved one's care delivery.
Yep.
And giving them full, complete transparency on how things are going when a care provider has rostered a schedule or scheduled a care appointment. But also giving them the ability to self-serve. I think that's been a big missing part. At this given stage, to this current day, we do see provider, because this is human nature, family members just calling the care provider to essentially ask for a change. And I think that is very much the only option in the current marketplace. But what if we lived in a world where everything is just at the tip of your fingertips? Now, maybe you would want to still call to get that reassurance, but at least 20 to 30% of the volume of calls are reduced because the care provider now has a window to be transparent to the family members. So to answer your question, I think it's very much allowing family members to have that transparency and sense of control over their loved one's care. And going back to the change of funding models, supported home is very much geared towards that, giving choice and control back to care recipients and their loved ones.
Yeah. And we're, as adult children of aging parents, we're so time poor. We all understand what the sandwich generation means, and I can just see the efficiencies in time management for families and for providers as well, utilising this software.
Absolutely. But also in improving the customer experience.
Yeah.
I think providers who have systems like this, it will actually help them to obtain or bring more customers to them because they are being very transparent with the level of service that's being delivered.
Yeah, absolutely. Ali, do you have any examples of how the organisations currently using Conpago are utilising this software, and what benefits do they report? I mean, we've discussed a lot of the benefits already, but what are you hearing from your actual clients that, have started using Conpago software?
The main one would be the ease of use. We actually designed Conpago in a way that it's one-touch functionality, making it super simple for anyone to be able to utilize our platform. I think the ease of use has been a massive one, which actually helps with the adoption rates as well. Because I think that's been the biggest challenge in the space is systems that are quite clunky or they're not very purposely built for the space. They're just being leveraged to utilize in the space because it can support. However, it's not purpose built. And being purpose built is really important because each persona would have different pain points. And I think for us, we want to factor in everyone's pain points into our offering.
Fantastic.
To make it super simple. In addition to that, I think the fact that we're quite responsive, we've got a very much a view of we want to have a unified approach across all different systems. So wherever you log in through a mobile phone, to a tablet, to a web-based browser, you'll still get the same outcome and everything's in sync. Because at the end of the day, we want to make sure that the whole system is being catered for everyone's digital literacy. A lot of care recipients still prefer using a web-based platform or a web-based browser. And I think I was talking to this about with a team yesterday is that mom and dad still like to use NetBank online on their web browsers. It's just because it's quite easy and it gives them flexibility to be able to get a bigger real estate in terms of a screen rather than using the banking app on their mobile phone device.
So if we have any providers listening in today, and I know we do, and they've gone, wow, this sounds really interesting. We want to know more about Conpago. We have the links in the show notes so people can follow up there. But is there an opportunity for providers to trial, to take a look? I mean, as I mentioned earlier, I've been into your offices and I've had a great look at how the software works. Can providers do that as well?
Absolutely. Absolutely. We give providers access to UAT environments, so user acceptance testing environments, so they can test it with their own data. So they can get a bit of a look and feel of how it actually interacts with their own systems and their own data. But absolutely, we actually encourage providers to reach out and to go through a pilot phase with us, because not every provider would have the same way of doing things. We're very much focused on building a tool that can be leveraged to the care providers' structures and processes. And I think that's something that we have to work with providers on. So piloting our solution has always been a key, because we want to standardize our offering for that particular provider or for that particular operator in the retirement space.
Fantastic. Ali, this has been an enlightening discussion for me, and I'm sure our followers will be thinking the same. I'm excited for Conpago about the benefits your program offers providers and consumers within the aged care sector. Thank you for your time today and for sponsoring our technology-themed month on the podcast.
Thank you, Coral. It's been a pleasure.
Thanks for tuning in to another episode. Do you have a topic that you'd like us to cover on an episode? Please reach out and let us know via social media or our website, seemeacn.com.au. That's SEEMEACN.com.au. All the links are in the show notes. And don't forget to hit the follow or subscribe button so you don't miss any of our upcoming episodes.